The most important reason I chose medicine, it started young. When I was a kid, I was more interested in the sciences, so chemistry, biology, more so than English or language or history. And as I got older, I gravitated towards medicine because it's a very dynamic and innovative field, in particular neurosurgery. And when I think about neurosurgery, I often think of aviation in much the same way. It started off as two guys, on a beach in Kitty Hawk, doing something that everyone told them couldn't be done. And you think about, it wasn't 50, 60, 70 years later that Boeing was unveiling a 747. And neurosurgery is much the same way. It started off with not two surgeons, but young surgeons who took their field to, a part of the body that was deemed by most off limits. You couldn't operate on the brain or the spinal cord safely. And to think where that has come in the last, whatever it is, 100 years to where we are now with neurosurgery, and all the different subspecialties and all the things that we're doing and treating, it's really very, very interesting. And to think about where the field is going to be when I'm ready to retire in 30 years or so, and the young residents coming out of training, the tools they're going to be using, the knowledge they're going to have that I never had, the tricks they're going to be trying to teach me, when I'm ready to retire, it's all very exciting. The most rewarding part about being a doctor, first, I think you have to give the generic answer, which is it's of course rewarding to be a part of helping people. It's always nice, every now and then when you get a card delivered to the office that says, Dr. Hoelscher, 6 months ago you did this so-and-so procedure, and I just want to let you know I'm feeling wonderful and thank you so much, or an email or something to that effect, and of course that makes you feel great. The other thing I would say that is really rewarding about medicine is a lot of friends of mine who are very successful in their careers, but they struggle a little bit to kind of identify the purpose or why they're getting up in the morning, and you really don't have that challenge in medicine. It's pretty obvious. It's not very difficult to find the motivation to get up and show up to work in the morning. And so I'd say the combination of those two is the most rewarding part about being a doctor. There's actually two questions that I think that I really wish people would ask almost every time you come to clinic. One of them is, how do I prevent a problem in the first place, rather than letting a problem develop and then trying to figure out a solution for it. And in neurosurgery, we don't always have the chance to have that discussion because as a specialty practice, oftentimes people are in our office because they've identified a problem. But in particular in regards to spine care, for example, how do you prevent back problems? How do you prevent neck problems? How do you, what resources are available to me that are not surgery that can help either prevent a problem in the first place, or now that we've identified a problem, how do I prevent it from getting worse? Because surgery, as much as it can be a solution to your symptoms and to make people feel better, it certainly is not as good as not having a problem in the first place. And to that end, the other question that I wish everyone would ask when we are getting to a point where we're talking about surgery is I wish they would ask me, Dr. Hoelscher, what are reasonable expectations for me? Like, what are your expectations for me? And, what should my expectations be for surgery? Because oftentimes people hear the word surgery and they assume that's just a fix. Everything goes back to normal and everything will be perfect. And I think sometimes in surgery we have to accept that we have to kind of set reasonable expectations for where we expect you to be in 6 weeks, 3 months, 6 months, a year after surgery. And if we can make sure that expectations from the patient and the provider end are aligned, I think that goes a long way in generating better patient outcomes. I am Dr. Christian Hoelscher. My mission at Jefferson is to improve lives.